What is the connection between new-onset diabetes and pancreatic cancer risk? Imagine suddenly experiencing unexplained weight loss, stomach discomfort, or a quick rise in blood sugar levels, especially if you're over 50. These signs might seem unrelated, but they can be linked to something more serious. When someone develops diabetes suddenly and they are older, it could be a warning sign of pancreatic cancer. This type of diabetes often appears within 2 to 3 years before the cancer is diagnosed. In fact, research shows that nearly half to two-thirds of people with pancreatic cancer also have diabetes, and most of these cases are new-onset, meaning they started recently. Interestingly, in many cases, the diabetes improves or even disappears after the tumor is removed through surgery, suggesting that the tumor itself was causing the diabetes. The pancreas is an organ that produces insulin, which helps control blood sugar. When a tumor develops in the pancreas, it can interfere with the cells that make insulin, leading to abnormal blood sugar levels and the onset of diabetes. This disruption is why new-onset diabetes in older adults can sometimes be a clue that pancreatic cancer might be present. Studies show that people over 50 with new diabetes are about times more likely to have pancreatic cancer than the general population. However, it is important to remember that most new cases of diabetes are not caused by cancer. Less than 1% of all new-onset diabetes cases are linked to pancreatic cancer. Despite this, doctors pay close attention when an older person suddenly develops diabetes, especially if they have other risk factors like a family history of pancreatic cancer, pancreatitis, gallstones, or unexplained weight loss. Rapidly rising blood sugar levels or difficulty controlling blood sugar can also be warning signs. Because pancreatic cancer is often diagnosed late and is very aggressive, catching it early can make a big difference. Researchers are working on developing better screening tools to tell apart diabetes caused by pancreatic cancer from common type 2 diabetes, which is much more common. In summary, new-onset diabetes in adults over 50 can be more than just a health inconvenience. It can serve as an important clue that prompts further investigation for pancreatic cancer. Recognizing this connection helps doctors identify potential cases earlier, which could lead to better treatment options. But since most new diabetes cases are not related to cancer, it's essential to consult a healthcare professional for personalized assessment and appropriate testing. Always seek medical advice if you notice sudden changes in your blood sugar or health, especially if you are in a higher risk age group.